I'm Tamara. I'm the Rheumatic Fever Nurse for 2 Compass Health, and I work as the mobile nurse. My job is to provide prophylactic services to patients diagnosed with rheumatic fever over the age of 16, and prefer to get their injections through the mobile service as opposed to through their GP, because I will go and meet them, and that makes it a lot easier for them to access monthly that injection until they're 21 or for 10 years, or whichever's longer. Although there is evidence to suggest that having the injection until age 30 is now recommended. Rheumatic fever is a preventable disease that is contracted following an infection of Group A Strep. It can affect the throat or the skin, and you get an acute infection. It either goes away by itself, your immune system, or you take antibiotics and it goes away. For a number of people, that infection will then move to the body. It then affects the heart, and that is the one lasting symptom that will continue throughout their life. When the heart is affected and the valves are affected, that then is no longer rheumatic fever and becomes rheumatic heart disease. We try and identify and treat patients with the strep infection before it gets to the rheumatic fever. What we find is most helpful is swabbing any sore throat and giving a dose of penicillin so that we can get rid of the strep bug before it moves to cause rheumatic fever. There is evidence emerging to suggest that skin infections caused by the strep bug can also lead to rheumatic fever. So looking at recurrent boils or kids that come in with skin infections and determining on whether or not you need to swab those also and treat with penicillin. Anybody that presents to a GP practice with a sore throat, especially if they're young, living in low socioeconomic areas, or identify as Māori and Pacific, those are our high risk groups, we would swab and treat them with penicillin. There is no cure for rheumatic fever. What we do try and do though is to prevent the rheumatic fever from reoccurring and causing further heart damage, which is why we give monthly penicillin injections. Some people with rheumatic fever will have such severe heart damage that they will require surgery. That can be a really significant change in a young person's life. It does mean that they will have to have anticoagulant medication for the rest of their life. Rheumatic fever is a disease that is not seen in the developed world. In New Zealand, it's actually got really high rates. We know that rheumatic fever spreads through gas, strep throat, and is exacerbated by conditions such as overcrowding, overcrowded houses, damp, mouldy, cold houses. Naturally, because it is amongst the populations that live in those places, in terms of social and health disadvantages, disproportionately affects our Māori Pacifica whānau, and so it's no surprise that rheumatic fever is predominantly in those groups, and that's why it's really important for us to work together with our Indigenous and Pacifica whānau to find a way to eradicate it, because it shouldn't be in New Zealand. Being a mobile nurse, the positives include meeting the people and their families, but it goes further than that with regards to education, ongoing education for them and their family and the community, so that we can avoid other people going down that same route. My job is rewarding.